Hello, my name is Trevor, and I'm 19 years old, and I have cystic fibrosis. Cystic fibrosis is a lung disease that causes mucus to build up in the lungs, and it makes it harder to breathe. Cystic fibrosis is not just hard for me, it's actually harder on my family. My mom's life, and also like my stepdad's life, it really has to like revolve around me, because they have to make sure like I'm always doing my treatments, my masks, making sure like I'm taking like all my medicines, and then just making sure like everything gets cleaned properly.
There are a lot of struggles when it comes to being a parent of a CF patient. Just the doctor's appointments that you have to do, and you look at Trevor and he's perfectly healthy. He looks like a perfectly healthy young man when on the inside he's fighting this terrible disease. And we could go to the doctor and his lung function has dropped. And then we may be facing a hospital stay, or we may be facing new medicines. And when we face new medicines, then we have to learn how we have to do them. And as he's gotten older, the new medicines are more complicated. They involve mixing medicines with syringes and all kinds of crazy stuff. But we just work together and figure it out and go from there.
When he was younger, we always had to make sure that he was doing his treatments, and he did a treatment in the morning and at night when he got up and when he went to bed. So when he's young, we have to wake him up, get him on his treatment, make sure he does that treatment, and then at night a lot of times he would fall asleep on that treatment, so that would mean staying up late with him to make sure that we got his treatment in. So it involved a lot of early mornings and late nights, just making sure he got his treatments.
So I also actually work. Whenever like I'm actually like at like work, it's really hard on me because I have to pick up chairs and like off like a really high shelf and put them down for everyone else to sit and try out. And then I'm also on like my feet all day, and like be like up and at it and talking to people like constantly. It's just it can be really hard and challenging, especially because people don't really see it or like understand. Because I don't like to really let my CF show that like I am struggling. I like to try and keep it like private, especially with like my like family, because I like to make sure like I'm like looking like I'm doing good and not really stress them out, because it's really not a burden that I don't want them to have to carry.
The hardest part about having a brother with cystic fibrosis is that when he's really sick or in the hospital, I worry about him so much. Something I do to help take care of Trevor is that when he's still shaking on his first mask, I get his next mask ready for him, and when he's done, I clean his mask.
One of the things we do every day to make sure Trevor gets what he needs is making sure he eats enough. He needs at least 3,000 calories a day to help make sure that he gains the weight that he needs or maintains the weight that he's at. And so every day we make sure he gets lots of calories. Every night we make sure that he eats 4 chocolate chip cookies before he goes to bed, so he gets the calories, many of the calories that he needs just to help sustain.
And as he's gotten older, my role as his mother, I guess, has become a little bit easier as far as the daily things, because he does so much himself. But just making sure he eats, and he takes a lot of medicine, so I make sure that we always have the medicine that we need from the pharmacy, and make sure that his pill thing is full for the week and he has everything laid out for the week.
CF does not stop Trevor from living an everyday life, because he can pick me up from school, he goes to Topgolf, he hangs out with friends, and he does all the fun stuff like other people, normal people, can do.
My doctor told me basically like all like my medicines, I'm becoming like immune to it, so I'm kind of running out of options in order to be able to fight my CF usually like the best way for me that I've done for years. And it's just really hard to really let that sink in, because you do everything right and like you really just can't help like what happens. But I think having a family is really good to have, to be able to like support me and always be there and let me know like I'm doing like a good job and just keep on going at it.